Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Margins are tight everywhere in healthcare, and a health system pharmacy adds value, especially when led by an established chief pharmacy officer. Jordan Dow, Chief Pharmacy Officer at Froedtert Health, joins me today to discuss the importance of the CPO role. Also joining me are my fellow Vizient colleagues, Michael Oinonen, VP of Pharmacy Networks, and our usual host, Gretchen Brummel, Pharmacy Executive Director for the Vizient Center for Pharmacy Practice Excellence. I'm Carolyn Liptak, also a Pharmacy Executive Director on the CPPE team, and your host for today's program. Welcome to the podcast, everyone.
Hey, Carolyn. Thank you.
Hey, good morning, Carolyn.
Happy to be here.
Gretchen, the listeners know you very well. Jordan and Mike, tell us a little bit about your backgrounds and roles. Mike, why don't you go first?
Sure, Carolyn, thanks. I am the Vice President over our pharmacy network here within the member network offering at Vizient. I've been with the organization for 26 years now, and I've held a number of leadership positions over that tenure that include time spent in our data analytics and insight space, leading member education and training, and ultimately leading to this role over the pharmacy network. For those listeners that may not know about the pharmacy network program or member networks in general, let me tell you that this offering exists to really help bring healthcare executives together to tackle these common problems and issues that they face, ultimately learning from each other, and members helping members is really our motto with the network program. I have the privilege of leading that with some of my colleagues over a number of other C-suite networks, few senior leader networks, and other topical groups. A great team supporting the pharmacy effort for Vizient.
Jordan, tell us a little bit about you.
Absolutely. Jordan Dow, Vice President, Chief Pharmacy Officer for Froedtert and the Medical College of Wisconsin, based in Milwaukee, Wisconsin. Get to wear a couple other hats as well. Technically, President of what we call Froedtert Health Pharmacy Solutions, which is our external facing segment of our business in pharmacy. And then also Assistant Dean in the Medical College of Wisconsin School of Pharmacy. Get to work closely with many of our pharmacy students, learners, and great faculty at the school. That's my day job. I also have the privilege of serving as chair of the Vizient Pharmacy Network, which is a true gem of a network, an incredible honor for me to work with colleagues across the country, pharmacy leaders, many chief pharmacy officers, and others who are all working together to help each other. Members helping members is really a mantra that we try to live and just help each other be successful, innovate, learn, and sometimes commiserate on some shared issues, and ultimately help advance pharmacy and advance the way we care for patients.
Those are super impressive backgrounds and foundational for what we want to dig into today. Jordan, what exactly is a chief pharmacy officer?
Carolyn, it's a simple question and a hard question to answer. As I think about a chief pharmacy officer, it's a pharmacy leader at an executive level in the health system. We'll talk more about what that means and what that looks like. Pretty briefly, it's somebody that's really strategic. They're truly part of the C-suite, which is a different space than pharmacy leaders have historically been. Really excited to have the conversation here today.
Can you tell us how the CPO role differs from other types of health system pharmacy leaders?
Historically, the top pharmacy leader has typically held the title of pharmacy director, and they've been over certainly a key department in the health system, but it's traditionally been viewed from other C-level leaders as a departmental director that's really there to be a support function in the acute care hospital space. Over the last 20 plus years, pharmacy footprint, the pharmacy stake in the health system, and just value of what pharmacists and our teams are providing the organization has evolved so dramatically that we've found an overdue need to have a pharmacy leader at the executive level that's part of strategic conversations and at tables that we haven't historically been at, giving us the chance as the top pharmacy leader to be strategic, to lean into the planning conversations and help inform proactively where we're going as an organization and not necessarily be seen as a reactive supportive function. The difference as I think about it is proactive, a key part of the C-suite planning process, and less about being a supportive reactive function.
That was really well said. And I feel your enthusiasm for being a pharmacy leader. Gretchen and Mike, I know you wrote a blog on this recently. Can you tell us more about that?
Yes, absolutely. With the blog, Mike and I wanted to get the word out as we see these important trends from a national lens, and we want our customers to know about the immense benefits of this role to their organization and ultimately to their patients. Everything really comes full circle because I've personally picked up a lot of these hurls from our members, so thank you for that, and some of you may recognize these as I go through them. Firstly, every patient in a health system interacts with the pharmacy. We're integrated everywhere. We're in the inpatient space providing medications and clinical services. We're in radiology when contrast is administered. We're in the clinic when a vaccine is given. We're in the emergency room. We're in the OR. Our pharmacy informaticists have built and maintain large components of the EHR. We're everywhere. Second, the pharmacy department is a huge source of revenue for an organization and also maintains a large component of the non-labor spend. Our research for the blog indicated anywhere from a quarter to a third of health system revenue is attributed to pharmacy, and some centers estimated up to half of all revenue coming from a pharmacy. Yes, half. And lastly, and perhaps most importantly, pharmacists are the medication therapy experts, and we're responsible for the pharmaceutical care of all patients in the health system. We're out there solving and preventing drug therapy-related problems every day. Some examples for you, you might have an ICU patient who's on continuous renal replacement therapy and extracorporeal membrane oxygenation who develops an infection with a multi-drug-resistant organism, and they need a brand new antibiotic, something that's never been dosed in a patient on ECMO and CRRT. The team's going to look to that ICU pharmacist for guidance on how to dose that and care for that patient. In the outpatient setting, the pharmacy team is also highly clinical. And in addition, they work through patient assistant issues, access concerns, help with prior authorization for patients. Jumping back to the acute care side, it's the pharmacy team who coordinates getting botulism immune globulin shipped in from out of state when an infant presents with botulism, which is a rare situation, fortunately, but it's highly specialized work. And again, through our focus on drug therapy, we may discover things like a patient who's been taking duplicate anticoagulation therapy due to a confusion or a mix-up between a brand and a generic name. Preventing and solving drug-related problems and managing a patient's pharmaceutical care is pivotal to improving healthcare quality and reducing cost. And these two things are at the top of the list for every healthcare organization. So it's critical to have this representation and participation at the C-suite level. Mike, what are your thoughts?
Yeah, thanks, Gretchen. That was well said. Vizient has been very intentional over the past few years about this elevation of the pharmacist to the C-suite. Part of the strategy of the pharmacy network and Vizient is to really create this overall awareness, engagement, in particular as it relates to this interaction with the rest of the C-suite. We know that these are not ancillary departments anymore. They're not cost centers. There are expanded roles, responsibilities of these leaders. And folks like Jordan are running multi-million-dollar businesses, billion-dollar businesses in some cases, and they're a significant contributor to the margin. Our goal with this blog and with this podcast is all around awareness. We know that a lot of organizations may not quite be there yet or may not have fully grasped or understood the value that pharmacy brings to their organization. And so we're hoping that this continues to spark conversation and allow people to truly embrace just how critical this role is and the function to the success of their organization.
Thanks, Mike. Does this CPO role apply to all health systems and all hospitals? Is this something that has a place no matter how big or small the organization is?
As health systems keep merging, coming together, the role of pharmacy is growing. And we're seeing historically many hospital pharmacy departments were really caring for inpatients and often doing that centrally with a relatively small team and a supportive function role. Over the last few decades, we've seen pharmacists much more engaged on the care teams clinically within the acute care side. And then we've seen incredible growth in the outpatient space and in the ambulatory setting where we have pharmacists embedded in clinics, directly helping care for patients and then helping tons of growth around retail, specialty, home infusion, outpatient infusion. In my mind, across that care continuum, we should absolutely see and have a pharmacist positioned at the CPO level. If organizations, hospitals are smaller, have maybe more of a traditional pharmacy service, it may not make sense for them, especially if you're a critical access hospital that has a team of 2 or 3 pharmacy staff. You might not need a CPO. It's somewhat dependent on your size and scale and where you see pharmacy working across your organization. There should be a connection to the pharmacy leader to make sure that they are involved and part of the strategy planning process, no matter how large or small your organization is.
Yeah, that makes sense, Jordan. Thanks. I've been in this profession for a number of decades, and this position was not something that was in place when I started working in pharmacy. Mike, tell us, how prevalent is this CPO role now, and what is the history? How did we get here?
If we were to do a simple technical exercise of searching for this specific title in the Vizient member databases, we would get a hit that returns somewhere in the neighborhood of 100 plus individuals with that specific title. But in reality, we know when we're talking with our members and others that we may not find that specific title. There may be similar roles and responsibilities at the organizations, but the title might be slightly different. It might be an executive director, it might be a VP or senior VP over pharmacy services, and those types of variations. That's typically what we see, but it is definitely growing. And I know, Gretchen, you have some thoughts around that as well.
I first encountered the role in an organization I was working at in the early 2000s. I think it's been climbing ever since. Right now, we're seeing more movement with it as a number of health systems are looking at their overall organizational restructuring due to things like mergers and acquisitions. So we're going to continue to see growth of the role. Jordan, anything to add?
From my perspective, wrapping up school in the mid 2000s, that was when I was first learning about it. I remember getting a chance to see Marianne Ivy's landmark publication highlighting the reason that we should consider having a chief pharmacy officer within pharmacy and really advocating for that for the first time. If you're not familiar with Marianne, her legacy within leadership in pharmacy is truly amazing. And I want to highlight for this network specifically that at the time that Marianne wrote that article, it was actually a white paper that was crafted when she was chair of what was the University Health System Consortium, which is what the Vizient Pharmacy Network is now today. This idea of having a chief pharmacy officer was first bubbled up through Marianne in the legacy Vizient Pharmacy Network, and this network helped spur the promotion of this idea and really the need for it nationally. If you haven't had a chance to take a look at that, certainly encourage folks to do that. It was published about 20 years ago now, and it's just amazing to see how that idea has really helped shift the role and elevated the opportunities for pharmacy leaders across the country.
Yeah, Jordan, I find that interesting as well that Marianne had the insight to talk about this and publish this 20 years ago. This is a great example of how something like the pharmacy network is really helping members elevate themselves personally and professionally, and it's exciting to be a part of that.
Thanks, Jordan. It's clear that this role is important. Gretchen, what do you think are some of the benefits of having a pharmacist at the C-suite level?
Having your organization's apex pharmacist at the C-suite allows your health system to be nimble. Nimble in your communications, it allows you to access information in your peers, and this improves transparency and efficiency. It also supports an integrated approach to system-wide decision-making and shared responsibility with your fellow chief officers. I, as a pharmacy leader, think that we need to address drug diversion issues or place a higher focus on them. And maybe the solution identified is implementation of a new AI-driven diversion software platform. This impacts nursing, so the CNO will want to work on this. It involves software integration, so the CMIO should be involved. It impacts risk management, so the chief compliance or risk officer should be included. You can see that it would make sense to have direct communications and shared responsibilities with those individuals built into your organizational structure.
As these leaders are closer to the C-suite, they ultimately are direct contributors to the development of that organization's strategy. Because of that, it's easier to disseminate that information, bring that vision closer. It's a natural conversation that takes place. You're living, you're breathing it every day. You're part of that process. And it's very easy to encourage and inspire others within the organization because of that. There's a different level of accountability that's enhanced when that pharmacy leader is elevated to the C-suite. Every patient coming into the hospital has some sort of medication interaction. Having that complete oversight of all medication-related activities and events means that they are even better positioned to optimize the highest and best use of this precious resource. As those layers are removed, decisions come quickly. This partnership with the other C-suite members, whether it's a chief strategy officer or chief financial financial officer. Maybe it's even working with the chief human resource officer on their self-funded plan or PBMs. These are subject matter experts that are critical in those conversations. Certainly at the table, they're helping being proactive in decision making and elevating potential issues that might come up. So maybe there is a planned merger and acquisition or additional capital planning. There's thoughts around expanding retail sites or changing sites of care or simply advancing patient access. These are all things that are critical conversations that the chief pharmacy officer needs to be part of. Bottom line, you need an operating model that has this subject matter expertise with direct line of sight. And these issues allows them to be part of that decision-making process.
I would agree wholeheartedly. Pharmacy leaders are trained and equipped to be good clinicians and help on the clinical side, to be good operators. We have to be to get drugs where they need to go across the enterprise, and then tend to have a very numbers kind of mindset. Part of it comes with training and dosing and other things. And some of us get into pharmacy because we want to help run a business and be financially oriented. And so to me, those three things, being really clinically thoughtful and operationally savvy and financially as well, set us up well to really add value at the C-suite across all functions. Being at a CPO level will help advance pharmacy and support the organization more that way, but we're going to help the organization really at all levels, all facets of the organization.
All of you made great points, and I certainly couldn't agree more, especially Gretchen. We know that drug diversion puts the organization at great risk and is not just a pharmacy matter. I also liked the use of the word strategic, because we think about all the great things we do with patient care, but there's also a lot of challenges and risk with medication use, and it needs to be addressed at a strategic level. I'm going to flip the next question a little bit. We know that this is an emerging trend, but not everyone has a CPO in place today. Gretchen, what do you think an organization is missing out on if they don't have a CPO yet?
It really boils down to the reverse of some of the things we were just talking about. If there are multiple layers of reporting, you can't react quickly to market trends and demands. You may be sluggish to implement initiatives, and you may potentially be in the dark about things because you just aren't hearing about them. Another point that I hear from folks a lot who have a few layers of reporting above them is pharmacy is highly complex. And to manage a pharmacy department, you need to know a lot. Your boss has to know a lot about pharmacy. And if they're not a pharmacist, who's going to teach them about pharmacy? You are. If they have leadership turnover, they're continuously re-educating new managers about the pharmacy department. This is really time that they could be spending focusing on things like improving patient care, quality, and their margin.
When I think, what is an organization missing out? Untapped potential comes to mind. Jordan mentioned and Gretchen talked a little bit about pharmacy's contribution to the revenue potential for an organization. If it's currently sitting at 15 or 20%, what could it be if we optimize all of those revenue streams, which involve pharmacy? Could be upwards of 40, 50%. Another is, you think of speed to market and profitability. Vizient's all about helping members achieve cost, quality, and market performance. And we need folks to optimize the workforce, make sure that they're working at top of license, expanded sites of care, patient access. These leaders have that vision and that strategy and are key contributors to that. And if you don't have those voices at the table, there's a fear of lagging behind in the market, and that's never a good thing. Finally, the argument could be made that a pharmacy leader is really a strong contributor to the building of a sustained, high reliable organization and culture mindset. Pharmacists are in a unique intersection of business-oriented, entrepreneurial. They have the clinical knowledge and skills. They understand the regulatory environment, and they're strong connectors across those disciplines for all those things that we talked about today. For those reasons, we feel like if you're not leveraging those resources to the best and highest use, then you will be missing out.
Pharmacy is so complex. It's a black hole for people who aren't in our space. And as our financial footprint is making up a third of the financials of the organization, month over month, questions come up about how did the financial performance look? Why was it this or that in pharmacy? And if the pharmacy leader is not at those C-suite level tables to answer those questions and talk about what went well, what didn't, and help inform the CEO and the board, then those questions sometimes go unanswered, or there's a lot of scrambling with multiple layers of conversations that probably wouldn't need to happen if the CPO was in the room.
Jordan, it's very clear that you're a very forward-thinking leader in this role. Where do you see things going in the future?
Certainly only see the role of pharmaceuticals and pharmacy continuing to grow and expand in our organizations. And that need only continues to grow as health systems continue to merge and acquire other assets. How we care for patients keeps evolving. But one thing that's always going to be there is pharmaceuticals as a key part of the treatment. And whether that's vaccinations or treating patients with infusions or giving patients an oral tablet to take or a cream or whatever that might be, ultimately we care for patients either surgically, procedurally by treating their condition, or we treat them with medicines, and medicines only continue to grow in the criticality of our care for patients and how we cure and manage patient symptoms. And I think the need is only growing for CPOs. I'm super excited about the future of healthcare, the future of innovative therapy. Cell and gene therapy, of course, is top of mind for me. $1 million plus medicines per patient per year. It's hard for me to get my head around, but it's real. It's here now and it's only growing. A lot of health systems are probably struggling to figure out, what do we do with these? How do we handle them clinically? Who should get these medicines? How should we work with the manufacturer appropriately to pay for them? And then with the payer to make sure we get paid for them. The CPO is the best person to have those conversations, the best position to be leading those conversations in our organization. It's just one more reason that the CPO needs to continue to be a key stakeholder around those kind of conversations. I'm very excited about the growth ahead of us in pharmacy and the opportunities for CPOs to add value for our organizations.
The future makes me think about the emerging leaders in this space. The need to have a business-oriented mindset is critical. That experience, having mentors in this space, will really help round out that future leader. They need to be engaged with the changing landscape. They need to be comfortable with advancing all of the technical and automation that comes with the changing environment. And I think they need to be a strong advocate for healthcare in the future. Most important, learning best practices from others is critical. I'm looking forward to a future where we're seeing more of the pharmacist being in this chief pharmacy role and contributing to that advancement for the organization.
This is the time to do this. We know a lot of our health systems are looking at their organizational structure to find ways to improve efficiencies, and they're discovering the value of a CPO. In terms of the future, the other trend that I've seen growing is a number of pharmacists stepping into C-suite roles outside of pharmacy, into COO or CEO positions, which I think is an exciting development.
All of you have done an amazing job today explaining the complexity of pharmacy and the importance of this CPO role. Thank you all so much for joining us today to share your expertise. And listeners, please join us for more Verified RX podcasts. Subscribe today, like us, and send us your comments. We'd love to hear from you. Verified RX is your prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Carolyn Liptak. Thanks for listening.